What is up, Chasers? We are back with another sponsored video. We have Miss Nikki Hogan with us today. How you doing?
How y'all doing?
We are going to talk about health insurance. We're going to talk about changes to your state's health insurance with all of this. Well, we can't say the word. We say the Rona over here, or we call it Sharona.
Her. You'll call it her.
Yeah, to talk about Medicaid and all that good stuff. So, I'm not the expert in this. Nikki is. And so, Nikki, tell us a little bit about what you do.
Yep. So I am an insurance broker. I focus only at this time on people who have Medicare and Medicaid because there's a special sector for them to get specialized insurance that typically has no cost to them. But insurance broker, worked for Social Security for 8 years, have been in the insurance world for almost 20. So that's my background.
Nice. Okay. So I'm sure things have changed, but I remember like when I was small and my grandma would like wait for the insurance man to come around like from apartment to apartment. Do you do that?
No, actually, we're not allowed to do that. That's the good thing about it. No, the Medicare market, you shouldn't be getting nobody coming up to you or going to your door just saying, hey, I do Medicare insurance. That's against the rules for us. But if you want to do like life insurance, they can still come knock on your door.
Okay. Nice. I was wondering too. I'm like, do Nikki be going and knocking down doors?
If it get rough out here. I gotta make my food or make my money to pay my bills. I might come knock on your door, but no, not for Medicare.
Okay, nice. And so tell us a little bit about what exactly is Medicare and Medicaid.
Got you. So Medicare is a federal health insurance. It's for people who are typically either 65 and older, or they're disabled and they be getting Social Security benefits for about 2 years. So at that point, they get access to Medicare, and Medicare covers only hospitals and doctors. It doesn't cover like dental and all that other stuff, and it typically costs about $144 a month out of their check. So, if you're on a fixed income, then that could be a problem because $144 could be a lot of money for somebody who doesn't have extra money coming in. Then you have Medicaid. Medicaid is a state program, and that is based off of your income. So if your income falls within a certain bracket, let's say less than $1,200 a month, then at that point in time, the state will be able to offer you Medicare or medical coverage through the state paying for it. And that's really the difference. One, Medicare we pay into by working. So all the time that you're working, you're seeing that extra Social Security tax come out your check. You're trying to figure out who is this OSADI company? Yeah, that's Medicare. That's Medicare.
Okay. That's that little pesky stuff. I'm self-employed now, so it's a little different. But yeah, that pesky little stuff coming out. Okay.
Yeah, that's her. That's her. We can't nothing we do, no exemption is gonna get her off that check.
Now let me ask you this, Nikki. With that being said, tell us a little bit about, let's say I have an older parent. Let's say we get them set up for Medicaid, and let's say they need like a surgery, or let's say they need a surgery. What would be the process of finding a doctor, finding someone in your network? Like, what kind of help is there out there for them?
Gotcha. So if you have an older parent and they are on Medicare, they're needing surgery, the best step I would honestly first do is, one, look and see based off of how much they get from Social Security every month. I would apply for Medicaid with their Social Security, because at that point, the state will come in and pick up where Medicare leaves off if they qualify. So Medicare only covers 80%. That leaves a bill of 20% to you. That could 20% of anything could be high or low.
Yeah.
So if your income, your parents' income is at $1,400 or less from Social Security, then I would apply for Medicaid for them, so that way they can get the state to pick up that 20%, and that's leaving them with no bill.
Okay.
One, and then two, find them some type of health insurance that goes with their Medicare, whether it's a Medicare Advantage policy or it's a Medicare supplement policy that will allow them to have access to extra specialists and things that Medicare does not cover. Medicare is going to cover just the basics, hospitals, doctors. But if you want some extra specialists, some extra advanced treatment, things like that, you're going to need some type of advantage or supplement plan that's going to give you that extra options. So do that afterwards.
Okay. And you know what? Now that you're saying that, I remember seeing commercials where it says like Medicare or, yeah, it will say Medicare, like Part A, Part B. I've always wondered, like, what is that stuff? But I guess it's one covers 80% and then the other picks up the rest.
Right. Yep. Well, yeah, A and B. A is hospital coverage, B is doctor's coverage, and then those commercials that you see in the middle of the day when, typically kids are taking a nap, those are people trying to advertise those Medicare Advantage plans that I was talking about. A lot of those plans cover, like I said, extra things that Medicare isn't going to cover. Your dental, your vision coverage. A lot of those plans have gym memberships or transportation on it. It's all in one plan.
Really?
Yeah. So I wish I had Medicare, but sometimes. But yeah, it's all in one plan. It covers hospitals, doctors, dental, vision, hearing, transportation, gym memberships, meals. If your parent is in the hospital and they come out of the hospital, they will deliver meals to their home for the first 14 days. So it's a lot of extra subsidies and coverage out here. And typically those types of plans are either $0 premiums every month, or they are like pennies on the dollar every month. But yeah.
So you know what? That's good, because if you have an older parent, like my grandmother that's still alive, she lives out of state. But I know one thing, like if I live there, I'd be like, no, you're going to take advantage of going to the gym. You're going to get out the house. You're going to keep moving, because you have to keep older people moving. So
that's true.
Otherwise they get, I don't really know how to describe it, but they get a little, I guess without human interaction, we all get a little different.
Mm-hmm. Yeah, you can see it now, us having to be in the house and kind of social distancing now. I went out a couple times. I've had to go out. I don't want to implicate myself, but the couple times I've had to go out, it was weird being back around people, because before Atlanta's packed and traffic and everything. So it's not that many people out, but being out amongst people again was like you had to get adjusted to it. So being away from people altogether without that human contact and connection, it does something to me. It does something to the brain. So those plans, they're there to keep you medically healthy and, Western medicine, and give you access to that. But also to me, it looks like it's there to also work on mental health as well, not just going to see a therapist, but like you said, getting out, talking to people. So
yeah. Absolutely. I know one thing I noticed too about being out. Everybody's like on edge, oh my goodness, God forbid you cough or you sneeze. Everybody turns around and looks like you got the cooties. You're like, no, I just have allergies. It's
right. Just normal body functioning. Yeah.
I find myself having to say that because I moved here from Arizona, and so I'm around grass. I'm like, no, I'm not sick.
I just never been around grass before.
It's weird. It's weird.
Completely, I get it.
Now, let me ask you this. Under Medicare or Medicaid, do they cover any holistic treatment, or is it Western medicine only?
Not under original Medicare. Okay. Original Medicare by itself, if you don't have one of those plans that I was talking about, absolutely not. You're not going to get that. But if you get one of those Medicare Advantage plans, a lot of those plans cover acupuncture, or the holistic doctor that you're trying to see may be in network with like the plan. I can't say their names, but with the plans, the insurance carriers that offer those plans, those types of doctors may be in network with those. But original Medicare is not going to cover holistic treatments. They're not going to cover mental therapists. They're not going to cover acupuncture, anything like that. It's just hospital doctors.
Okay. Because I like to sit over here and meditate with my crystals, so I guess they're not gonna pay for no crystals.
They ain't having that. No.
They're not paying for no meditation, no yoga classes. Okay, all right.
No.
Now, my next question is, because I've always wondered this. So, let's say you're on Medicare. Can you still receive that and receive like food stamps and other government funded programs?
You can, but it's at a very limited amount. Unfortunately, a lot of the seniors that I've run into, they typically only get like $16 a month.
What?
Kid you not. They typically only get like $16 a month. That's why it's so important that if you have somebody in your family or you know someone that has Medicare, or they may only have Medicaid, but they're getting like SSI disability and they need help applying for Medicare, it's important to get them that help because they're living on that fixed income and they're not like other people that may get like $400 or $500 on their food stamp. I have not seen more than $16.
Wow.
Yeah.
Wow.
Yeah, that's why you see so many seniors at like food pantries and things like that because they're getting this fixed income. They have health issues, so they have to typically go to the doctor and spend co-pays and prescriptions, and they still have bills to pay.
Yeah, that's what you said.
It is. That's why I work in the market that I work in because they need that help, and it's more advocate work than anything. But they need that assistance and somebody to be able to let them know that there's programs out there to help them, and not just, unfortunately, that typical stereotype of government worker that just comes in, signs you up, and don't give you that extra help that you need.
Yeah, I know, coming in and they don't even remember your name, no personality. Like the short time I did social work, I never wanted to be that social worker of just like coming in. What's your name again?
Right.
Yeah, okay, yeah, you look all right. All right, I'll be back next month. Like I just never wanted to be that. That's
hold your arms up, stick your tongue out. You're all right. Yeah, that's the hardest thing in the world. When I worked there, I'm so thankful that my journey has got me to this point. But that was hard working for Social Security because not everybody is lazy, but some people are, and you see so many patients and not patients, but beneficiaries that need help. And a lot of those workers, they just want to get you in and out so they go home. So yeah, it's it's in the industry. Somebody's gonna go the extra mile and somebody's just not. So
that's what can you do?
Yeah. So, go ahead.
Let me ask. Okay, I got so many questions now, even as you're thinking. So let's say I'm an older person, I'm getting my Medicaid and stuff. What if I live with my adult child and they make good money? Can I still get my health benefits and live with someone who could theoretically take care of me?
Yes, because their income is not considered there to take care of you. Their income is there to take care of their home.
Okay.
They have extra expenses outside of you. They're not expecting that your child's income is there to fend for you.
Gotcha.
So, yes,
okay.
Absolutely.
So even if my son is Jay-Z and I live with Jay-Z and Beyonce, can I still get my Medicaid?
You can. Now we're gonna question why your son, what's going on between y'all that he's not giving up a little extra money. But no, you can, because my money is not your money. Your money is my money. We don't all manage our money well. So just because you make a certain amount doesn't mean that you're allocating some of that money here and there, and I'm included in that. So
that is true. Okay. Well, somebody in the chat said R.I.P. to Betty White. Have you seen how all these celebrities have been dying over the weekend?
When did that happen?
She died this morning. Yeah.
That's weird. That's something. Yeah, I don't even want to go. No.
Yeah, she died this morning. Then Little Richard died yesterday, and Andre Burrell. I'm like, dang.
That's crazy. I didn't know Betty White.
Oh, Betty Wright, the singer.
Yeah.
Yeah.
The fast, fresh tail singer. Have you heard those songs?
Learning her man while she was earning her man.
Woman to woman.
Look, y'all better go listen to that stuff. She was teaching y'all a lot of her music.
I know, I didn't know that. That's crazy. I'm sorry. Rest in peace.
Yeah.
That's a lot within like 48 hours.
Right. So no, you guys, Betty Wright, not Betty White, not Golden Girl. She's still
She
alive.
been passed away, right? I thought Betty White passed away not too long ago.
She's 98.
Really?
Let me
I'm
double.
sorry. I retract that. I don't want to kill off Betty White.
Yeah, please don't kill off Betty White. Hold on, I'm gonna look at it right now.
I thought she passed away.
No, Betty White just signed up to do another movie too, and
Really?
she's 98 years old.
Wow. Whoa. Okay, I take it back. I'm glad she's still alive. Damn, Betty. How old was Betty Wright then?
Betty Wright was 66.
What's going on?
I don't know, but whatever Betty's drinking, I want it.
Me too. Her and Cicely. I want what's her and Cicely Tyson drinking.
Yes, definitely.
That's
Okay.
crazy. But yep, that's that Medicare age, that's 60. We got to do better. We need to definitely in our community take advantage of a lot of these resources that's out there. So we can be 98, kicking it, living and not spending our money on things that's out here to give it to us for free and help us. And it's not like it's income based. It's there because you worked into the system enough that once you get to that age or that status in life where you need Medicare, you shouldn't have to pay for all these extra things.
That's true. That's very true, because you will more than likely be on a fixed income, because everybody can't work well into their 80s and stuff. Some people, their body, it won't let you. So
right. Yeah, this is the time where you should be able to relax. And unfortunately, sometimes, and that's a whole nother conversation, we don't spend our lucrative working years kind of making proper investments so that way when we get to that age that we have good streams of income coming in and we're not living off just this one. But yeah, there's a lot out there. And then during this time, there are a lot, if you have Medicare, there are a lot of insurance companies that are, if you have those types of plans, Medicare plans, they're waiving or completely eliminating like co-pays, co-insurance, deductibles, things like that. If you have certain plans with them, because a lot of those plans still have like a co-pay here and there, but yeah.
Now Ashbash asks, how can we contact Nikki for help? So how can they contact you?
Yes, so on my Instagram account, my Instagram is coveredatlastllc. So coveredatlastllc. Covered at last.
All right.
And
is there any other contact info?
Mm-hmm. And my email address, that's long, but it's you can do coveredatlastllc@gmail.com.
Nice.
And then we work across the United States. So if you're in Puerto Rico, California, it doesn't matter. We're able to assist, but yeah.
Now I have a silly question for you.
Shoot.
But my brain thinks like this. Okay, if I'm from Georgia, but I'm an old person that's hip and I like to dip it and do it, and I'm in New York, can I still use my benefits in a New York hospital?
So here's the deal. That's depending on the type of, if it's emergency purposes, yes, you can use it wherever you are. If you just up there because you got a little friend up there or whatever, and you just hanging out and think you just gonna see some doctors up there, you need to have a certain type of plan, and that's a PPO plan. That's preferred provider network, which allows you to go in and out of network, so you don't have to just stay in one place. HMO is restricted to just certain doctors that are in that network. You cannot go outside of that network. You will have no coverage if you do.
Okay.
So it depends on the type of plan you have, but yeah.
Okay.
I've heard some of the funniest things. You're right. You just reminded me of somebody, but that's okay.
But then, because I think about that, because like when I'm old, I will still be hip. Like that's my plan, to still be shimmy in the shoulders.
You're gonna have one of them hats on with the feathers in it, still out there going to Ella Ray's with chicken dinners and stuff. I'll tell you about this guy that just in passing, and we were just talking about the insurance or whatever, and he was just looking or whatever. You know how guys are, but I was like, "Aren't you married or whatever?" And he was like, "I can look at the menu. I ain't got to order nothing." You learn a lot of game in this business.
Wow.
It was funny.
But now, yeah, that is funny. Wait, why did Ori comment and say, I'm going to be an old hoe? You know what? That's your business, Ori.
I will be here to help you along your way to make sure you stay healthy.
Do you still, do the older people, do they still have access to like, I guess it would cover it for like their sexual health too, if they catch STDs in nursing homes or anything like that, you know?
It's big in that community. They still get down. Yes, it's still that stuff is there to help them with all types of preventative methods. So a lot of those types of screenings, tests, things like that, those are covered at 100%. And like I
Nice.
said, during this time, a lot of plans or carriers are completely getting rid of copays, deductibles, all that stuff until the ending of the year. So you should be able to go to the doctor for anything, depending on the carrier you have, and not have to pay anything, whether it's a screening test or whatever.
Nice.
Yeah.
And do any of the plans under the Medicare umbrella, do they cover like aging care, like a at-home nurse if the elderly person needs that?
Yeah, they do. They cover home health care. That's covered under it. Skilled nursing facilities are covered under it.
Okay.
So, yeah, it cover. You think of it. Think of as many health insurance plans that we typically, without Medicare, would have to go and buy individually.
Right.
Like they put all that in one for them. And like I said, about 97% of those plans are $0 premiums. So,
Nice.
yeah, yeah, it's just
That's
getting the word out there.
Yeah, it's just getting the word out there because a lot of people don't know. And then, let's say you're an older person, you're not tech savvy. That's where you would come in to help them, right?
Yep, yep, yeah. We can do it over the phone, in home, however they're comfortable with doing it. But yeah, we're there, and there's no charge for it. It's not like, oh, okay, we can come help you, but we need you to pay us this. And no, there's no charge for any of that. That stuff that's access to them for free. We just assist them with getting it set up.
Nice.
Yeah.
Okay. See, look, y'all come over here. Y'all get everything on the Storm Show. Everything you need. I cover you from head to toe.
Yes, this is good.
Now, are there any, well, actually, no, let's let them ask you a few questions before we head out.
Okay.
I think we covered some good stuff today. So, guys, any questions you have for Nikki, shoot them in the chat. We got actually more than usual for a sponsored channel. So, sponsored show. So that's what's up.
Yay.
Okay, Brandy said a lot of old men be tricking. You know what, Brandy? That ain't got nothing to do with Nikki. Brandy, I said question.
I caught a glimpse of it. Wait, bring it back.
I ain't got nothing to do with that now, Brandy. What about the questions, guys? Oh my goodness. I do have a question. Have you had any old person get pregnant?
No, I have not experienced that there yet. But since you put it out there, I'm probably no.
You get that 60-year-old like that has a miracle baby. Like, what do you do?
Lord, no, please. I'm gonna have to jot that down. I think I need to go back. I've never thought about that.
Does Medicare offer anything for like funeral costs? If say the person dies and they have they don't offer anything? Okay.
No, you have to have a life insurance policy for that. There are some really good life insurance companies that do. Senior Life is one of them. Actually, they're really, really good. They will put in like a package with the life insurance policy to help you pick caskets, headstones, all that good stuff, and the life insurance company itself will negotiate the rate. So at the time when you know your family members passed away, you don't really want to have to constantly go through cost of things and doing all that stuff. The life insurance company will do it for you. They'll find funeral homes in the area and negotiate the rates, get everything set up. So all you really got to do is just kind of go to the funeral. So yeah.
That's dope. Now, Paul said I'm on I guess they meant SSI.
SSD, I know he's right. He's on Social Security Disability Insurance.
Oh, okay. And have Medicare, but I never used it. What does it cover?
You have Medicare, but never really. Oh, wow. So the Medicare you have, like I was saying earlier, the Medicare itself only covers hospitals, doctors, and it only pays 80%. You would be left with a 20% bill. But depending on how much money you get on SSDI, we can help you apply for Medicaid. So that way, Medicaid will pick up the 20% that Medicare is leaving you with. And then that $100 and something that's coming out of your check for Medicare, it may not be if you already have Medicaid, but if it's still coming out of your check, the state will pay for it for you. So you can get that money back on your check.
Okay.
And then at that point, then you can get like a Medicare, and you can get it now, honestly. You can get a Medicare Advantage plan that covers, like I said, the hospitals, doctors, dental, vision, all that, the gym membership, all in one. You could get one of those now because of the COVID stuff that's going on, the Rona, all that stuff that's going on. There is a enrollment period that's going on right now until the ending of June. So people who have Medicare can go ahead and kind of make some plan changes and get into a Medicare Advantage plan, things like that, because of what's going on. So you definitely may want to look into getting into something now, so that way you can have that extra coverage that Medicare doesn't cover.
Nice. Okay. Michelle said, what is available for an 18-year-old suffering from depression, is diagnosed with bills that the family cannot handle the burden?
You can apply for Medicaid. They can apply for Medicaid. If they have been diagnosed, I guess that's by a doctor, you can apply for Medicaid, and then they can also apply for SSI, not SSDI, but SSI. There's a difference. SSDI is for individuals who have worked for 10 years.
Oh, okay.
Through that system, through that tax.
Right.
Then when they become disabled, they can go apply for disability through Social Security and get SSDI. SSI is still through Social Security, but what it's saying is that you have not worked in the system long enough to pay taxes, but we will still give you some type of monetary, monthly amount because you're disabled. But it's not gonna exceed like $771.
Wow. Okay, Don't Got Time Williams said, any Black-owned insurance companies? I don't know of any.
These others charge so much. Not on the health insurance side. On the life insurance side, there are.
Yeah.
Yeah, there are a lot of Black-owned life insurance companies, but not on the health insurance side. It's a small market. You can probably say off the top of your head the big ones. I can't really say it right now because we're not advertising for them, but no.
Okay. Well, I tell you what, Don't Got Time Williams, you can always be the first. All right.
Amen. I'll sign up with you.
Do you hear me? Let's see. Oh, Michelle said, even if they live at home. Yeah, but they're still 18. So yeah, they can still do that.
It doesn't matter.
Yeah.
It doesn't matter. They're an adult now. So yeah, he definitely needs to apply because he hasn't worked in the system long enough. If he's only 18, I would definitely apply for SSI for him.
Nice. Okay. Let's see what else we got. Paul said, thank you. I will be contacting you for more information.
Oh,
nice.
Yeah, I'm here.
That's what we like to hear. Before we wrap up, let me just let everybody know that it's in the chat that we are implementing the Storm Monroe sponsor hour. So overnight, you will see all of my sponsors roll back to back to back. You know, just in case you can't catch it now, you can catch it later. You will catch it on Sundays as well. So make sure you guys stay tuned. If you want a 20 to 30 minute slot to advertise your business, your channel, your IG page, your Facebook page, whatever you got going on, DM me or email me for rates. Okay. Y'all come get this money and help me get this money. Any last words, Nikki?
No, thank you. Thank you. Thank you. I appreciate all the questions. They're awesome. I learned something today myself, that senior getting pregnant stuff. So I'll go figure that out. But no, it was good. I appreciate, like I said, I can't say it enough. I'm truly grateful. And if you guys, like I said, have any questions, feel free to reach out to me on Instagram, coveredatlastllc, or you can reach me at coveredatlastllc@gmail.com. So happy Mother's Day, everybody, also.
Absolutely. Happy Mother's Day. Nikki, thank you for coming on. Anytime you want to come on, you are more than welcome.
I appreciate it.
Take it easy now.
All right. Bye, y'all.
Bye-bye. All right, guys. So we had us a darn good show. Look at y'all coming over here and learning. Look at y'all coming over here and learning. So like I said, if you want to slot on the Storm Monroe sponsor hour, it will be airing. It'll be like the midnight shift between 12 and 3. You can get you a 20 to 30 minute slot. DM me or email me for rates. I'm going to make sure I put Nikki's info in the description box here. I'm going to come on a little later. I think I might come back in like 15 minutes and do my Mother's Day show where I just mess with y'all. Can I provide her email address again? I sure can. We'll put it right in the chat. coveredatlastllc@gmail.com. And if for some reason she doesn't see your email or you don't get a response, DM me or email me and I'll pass it along to her too, because I always talk to y'all anyway. So I'm finna get off here and get some water, and I'll come back and mess with y'all and make y'all laugh for Mother's Day. So like, comment, subscribe, share if you care, and I will catch you guys later.